Hello, welcome to another edition of our CNS video blogs. Today we're going to talk about our new service that we're providing for DOT medical exams. We have John Reel here today, and he's certified through the National Registry of Medical Examiners. We're super excited to have him here, and we want to ask him a few questions. So John, can you tell us a little bit about yourself and your medical experience?
Sure, thank you. Well, first of all, I'm thrilled to be with CNS and helping to provide this new service in DOT medical examinations. And I'm a physician assistant, certified both in primary care and surgery. Been a PA for 35 years and a variety of experience, including family medicine, occupational medicine, and pulmonary medicine, and also urgent care experience. As a PA doing DOT medical examinations, it's very important to me that we communicate well with our drivers and the companies that represent them, and that we provide efficient service, good education, that we not waste people's time.
All right, so John, can you tell us a little bit how CNS physical exams are going to differ from the other providers?
Sure. One of the most important things is that when the drivers or the patient coming in for the exam comes into our facility, to make them feel very comfortable and welcoming, and that the exam is certainly what they expect. Number two, letting them know that we provide the examination and all the elements of the exam all in one location here at CNS, and making sure that we not only educate them and answer all their questions, but that it's a very time-efficient exam, that we don't waste their time, and that they have a very good experience, so that they tell their coworkers and the companies why they should choose CNS over other organizations that provide the same service.
So John, run us through the typical process for a DOT medical exam.
Sure. Well, the patient will come in certainly with their medical examination form, and we will do the various paperwork and identification when they first come in. And then what they can expect is to obviously perform the various elements of the exam, which is providing us with a urine screen, which we will check and make sure that there's no abnormalities there. They'll be in a friendly way then escorted back to our examination room, where a visual exam, a set of vital signs such as blood pressure and pulse oximetry and heart rate will be taken. I will perform the exam, which essentially is a very cursory or directed head-to-toe exam, checking things like their heart rate, their breathing pattern, their eyesight, their hearing, their neurological exam, asking them a number of history-related questions such as, medical problems, medications they're on, and then once they're identified as qualified for the DOT certification, completing some cursory paperwork and efficiently getting them on their way, answering any questions they might have through the exam.
Next question. What would be some of the issues preventing some drivers from passing the exam?
Well, first of all, coming prepared, such as bringing the medical exam form with you and having that front page of the medical exam completed when you come saves time. But some of the more exam-related reasons why drivers may not qualify is certain medications that they're taking, certain medical conditions that they have, such as eyesight, hearing, history of seizures, history of diabetes or blood pressure, that may make some of the readings that we take during the exam be abnormal.
John, I know you mentioned before that you would work with the drivers. You want to expand upon that?
Absolutely. If we identify elements in the DOT exam which would keep them from being certified, let's say for a full 2 years, or the normal interval, such as high blood pressure, having sugar in your urine, having certain medications that you're taking that may cause dizziness or other symptoms that may not be, safe for driving. We work with the drivers, such as, a lot of times we'll let them relax for 5 or 10 minutes and check the blood pressure again, trying to get it down to the acceptable level of 140/90. If we identify that there's a problem with sugar in the urine or other abnormalities of testing, we work with them and give them the education, also written instructions as to how to go back to their family doctor and get those situations taken care of, and then return to us in a short time so we can do our very best to certify them without a delay as best we can.
In addition to our medical exam service, we will be attaching the certification to your driver's license as well and taking it up to DOT. So can you tell us more about the mobile on-site exams?
First, in close coordination with the companies and their decision makers, such as managers, HR people, and the safety people at the companies, the on-site operations are particularly important when you have larger volumes of workers or drivers that need to be processed or need to be examined all in one location. We can do things like set up an on-site, like a mobile unit or an on-site service, where we can handle like large numbers, many times in excess of 100 to 150, with additional personnel such as medical assistants and a dedicated registration person, where it's a lot more convenient than having those large numbers come to our stationary facility. In addition to being able to process larger numbers of DOT exams, we can also much better identify medical problems that may need to be addressed by their primary care physician or their family doctor that are keeping them from being certified at that time, but then in a very short period of time could be corrected, and then in addition to an additional on-site service in the future, be able to come to our mobile or our stationary locations and get certified after they correct those.
All right, so anyone out there that has a medical card expiring soon, please make an appointment with us. John will take care of you. If you want to make your appointment online, that's possible. We'll have our information below on the screen here tracking